Pregnancy changes the way you think about everything. Suddenly, even the smallest decisions feel important. You get a headache and stop before taking anything. You catch a cold and wonder if normal medications are still safe. You open your medicine cabinet and realize something frightening. The medications you trusted before pregnancy may not always be safe now. And the reason becomes especially important during the first trimester. This is the stage where your baby's organs are forming. The brain begins developing. The heart starts beating. The spinal cord, limbs, kidneys, and facial structures are all taking shape. It's one of the most delicate periods of human development, which means certain medications can interfere with these processes in ways many women never expect. What makes this even more concerning is that some risky medications are very common. Some are prescription drugs. Others are medications people buy casually over the counter without thinking twice. In this video, we're going to walk through 7 medications that should generally be avoided during the first trimester of pregnancy, explaining not only what these medications are, but exactly why they may be harmful and what safer options may exist. Because when you understand what's happening inside your body during pregnancy, protecting your baby becomes much less confusing and far less frightening. Now, why medication safety matters in the first trimester. The first trimester is often called the foundation stage of pregnancy because this is when organogenesis occurs, the process where your baby's major organs and body systems begin forming. During these early weeks, cells are dividing rapidly and transforming into specialized tissues. The brain, spinal cord, heart, kidneys, limbs, and facial structures all begin developing during this period. Because development happens so quickly, the embryo is extremely sensitive to outside influences, including medications. Certain drugs are able to cross the placenta and enter the developing fetal circulation. Once there, they may interfere with cell signaling, tissue growth, blood flow, or organ formation. Some medications can increase the risk of miscarriage, while others may contribute to structural birth defects or developmental complications. Research published by organizations like the U.S. Food and Drug Administration and the Centers for Disease Control and Prevention emphasizes the importance of medication review before and during pregnancy. This does not mean every medication is dangerous. Many medications are necessary and life-saving during pregnancy. The goal is not fear, it's awareness, caution, and informed decision-making. The first medication is Isotretinoin, severe acne medication. One of the most dangerous medications during pregnancy is Isotretinoin, a powerful drug commonly prescribed for severe cystic acne. This medication is extremely effective at reducing oil production and controlling severe acne outbreaks. However, it is also one of the most well-known teratogenic medications in medicine, meaning it can cause severe birth defects if taken during pregnancy. The reason Isotretinoin is so dangerous is because it directly affects how cells grow, divide, and mature. During the first trimester, your baby's organs are developing rapidly, and Isotretinoin can disrupt these developmental pathways. Studies published in the New England Journal of Medicine have shown strong associations between Isotretinoin exposure and abnormalities involving the brain, skull, ears, eyes, heart, and facial structures. Some infants exposed during pregnancy develop central nervous system abnormalities or congenital heart defects. There is also a significantly increased risk of miscarriage and premature delivery. Because the risks are so serious, strict pregnancy prevention programs exist for women taking Isotretinoin. In many countries, women are required to undergo regular pregnancy testing and use contraception before receiving prescriptions. What makes this medication particularly important to discuss is that many pregnancies are unplanned. A woman may continue taking the medication before realizing she is pregnant. This is why dermatologists strongly advise stopping Isotretinoin before conception and discussing safer acne alternatives during pregnancy. Treatments like topical azelaic acid or certain pregnancy-safe skincare approaches may be considered instead under medical supervision. Number 2. Ibuprofen and NSAIDs. Many people are surprised to learn that common painkillers like ibuprofen may not be ideal during early pregnancy. Ibuprofen belongs to a class of medications known as NSAIDs, or nonsteroidal anti-inflammatory drugs. These medications reduce inflammation and relieve pain by blocking substances called prostaglandins. While that sounds harmless, prostaglandins play important roles in implantation, blood flow regulation, and pregnancy maintenance. Several studies published in journals such as BMJ have suggested that frequent NSAID use during early pregnancy may be associated with an increased risk of miscarriage. Researchers believe this may occur because prostaglandin suppression can interfere with implantation and early placental development. Later in pregnancy, the risks become even more concerning. NSAIDs can affect fetal circulation and may prematurely close a vital fetal blood vessel called the ductus arteriosus. Because of this, these medications are especially avoided during the third trimester. Another issue is that many people use ibuprofen casually for headaches, muscle pain, fever, or menstrual-like cramping before realizing they are pregnant. Healthcare providers often recommend acetaminophen as a safer alternative for pain and fever during pregnancy when used appropriately. However, even safer medications should still be used thoughtfully and according to medical guidance. The important lesson here is that over-the-counter does not automatically mean safe during pregnancy. Number 3. Warfarin blood thinner. Warfarin is a medication used to prevent dangerous blood clots, strokes, and certain heart complications. For many patients, it can be life-saving, but during pregnancy, especially the first trimester, it carries serious risks to the developing baby. Warfarin crosses the placenta easily and can interfere with fetal development during critical stages of organ formation. One of the most recognized complications is something called fetal warfarin syndrome. This condition may include abnormal facial development, nasal deformities, skeletal abnormalities, growth restriction, and developmental complications. Studies published in journals like Circulation have documented these risks extensively, particularly when exposure occurs between weeks 6 and 12 of pregnancy. The medication works by blocking vitamin K, dependent clotting factors. Unfortunately, vitamin K is also involved in developmental pathways related to bone and cartilage formation in the fetus. In addition to structural abnormalities, warfarin exposure may increase the risk of miscarriage, bleeding complications, and neurological problems. For pregnant women who require anticoagulation therapy, safer alternatives such as heparin are often used because they do not cross the placenta significantly. What makes this topic important is that many women taking blood thinners may become pregnant unexpectedly. That's why pre-pregnancy medication counseling is extremely important for women with clotting disorders or heart conditions. Pregnancy does not mean stopping all medications blindly. It means adjusting treatment carefully to protect both mother and baby safely. Number 4. ACE inhibitors. Blood pressure medications. Medications such as lisinopril and other ACE inhibitors are commonly prescribed for high blood pressure, kidney disease, and heart conditions. Outside of pregnancy, they are highly effective medications, but during pregnancy, they can become dangerous to fetal development. These medications work by blocking the renin-angiotensin system, which helps regulate blood pressure and fluid balance. However, this same system is also critical for fetal kidney development. Research published in journals like The Lancet and the New England Journal of Medicine has shown that ACE inhibitor exposure during pregnancy can interfere with normal kidney formation in the fetus. This may lead to reduced amniotic fluid levels, poor lung development, impaired skull growth, and fetal growth restriction. Reduced amniotic fluid is especially concerning because amniotic fluid protects the baby and supports normal organ development. When fluid levels become too low, complications can become severe. Although the greatest risks are often associated with second and third trimester exposure, many experts recommend avoiding ACE inhibitors entirely during pregnancy because early developmental effects may still occur. Safer blood pressure medications are available during pregnancy, including options such as labetalol and methyldopa under physician supervision. Women with chronic hypertension who are planning pregnancy are usually advised to review their medications beforehand to reduce risk during those crucial first weeks of development. Number 5. Tetracycline antibiotics. Tetracycline antibiotics are commonly used to treat infections such as acne, respiratory infections, and certain bacterial illnesses. While effective, they are generally avoided during pregnancy because of how they interact with developing bones and teeth. Tetracyclines bind strongly to calcium. During pregnancy, Calcium plays a critical role in fetal bone and tooth formation. When tetracycline crosses the placenta, it can accumulate in fetal tissues undergoing calcification. Research published in the Journal of Antimicrobial Chemotherapy has shown that exposure may lead to permanent tooth discoloration and impaired bone growth in the developing baby. Teeth affected by tetracycline exposure may later appear yellow, gray, or brown. Another concern is that these medications may interfere with normal skeletal development during critical growth periods. Although the risks are more pronounced later in pregnancy when teeth and bones mineralize more actively, many clinicians avoid tetracyclines throughout pregnancy to minimize potential complications. Fortunately, many infections during pregnancy can be treated with safer alternatives such as penicillin-based antibiotics or cephalosporins, depending on the infection involved. This is why self-medicating leftover antibiotics during pregnancy can be risky. Not every antibiotic is interchangeable, and pregnancy changes the safety profile of many medications. Number 6. High-dose vitamin A supplements. Many people assume vitamins are always safe during pregnancy, but with vitamin A, excessive amounts can actually become harmful. Vitamin A is essential for vision, immune function, and fetal development. However, high-dose vitamin A supplements, especially synthetic retinoid forms, can increase the risk of birth defects during the first trimester. Research published in Teratology and Developmental Biology journals has linked excessive vitamin A intake to abnormalities involving the brain, skull, heart, and facial structures. The reason is that retinoids strongly influence gene expression and embryonic cell differentiation. During early fetal development, small disruptions in these signaling pathways can lead to structural abnormalities. This is why prenatal vitamins contain carefully controlled amounts of vitamin A rather than extremely high doses. Some people unintentionally consume excess vitamin A through multiple supplements or certain acne products derived from retinoids. Liver-based supplements can also contain very high concentrations. Healthcare providers usually recommend avoiding unnecessary high-dose supplementation during pregnancy unless specifically prescribed. The important point here is balance. Vitamin A deficiency is harmful, but excessive intake can also be dangerous. Pregnancy requires careful nutritional moderation rather than assuming more is always better. Lastly, misoprostol. Misoprostol is a medication with several medical uses, including ulcer prevention, labor induction, and medical pregnancy termination. Because it stimulates strong uterine contractions, it can be dangerous during early pregnancy if used unintentionally or without medical supervision. Misoprostol works by acting on prostaglandin receptors in the uterus, causing the uterine muscles to contract. During the first trimester, this can lead to miscarriage, heavy bleeding, or incomplete pregnancy loss. In pregnancies that continue after exposure, studies and case reports have documented associations with certain congenital abnormalities, including limb defects and neurological complications. The World Health Organization recognizes misoprostol as an important medication in obstetric care, but emphasizes that its use must occur under proper medical supervision because timing, dosage, and indication matter significantly. One reason this medication is important to discuss is because in some regions, people may obtain it without full understanding of how powerful it is physiologically. Pregnancy is extremely sensitive during the first trimester, and medications capable of altering uterine activity should never be used casually. Even medications with legitimate medical uses can become dangerous when taken inappropriately during pregnancy. In conclusion, the first trimester is one of the most delicate stages of pregnancy, but it's also one of the most important times to become informed about what enters your body. And here's the reassuring truth. You do not need to live in fear of every medication. You simply need awareness, caution, and guidance. Always speak with your healthcare provider before starting, stopping, or continuing medications during pregnancy, including over-the-counter drugs, supplements, and herbal remedies, because protecting your baby doesn't come from panic. It comes from informed decisions made with knowledge and care. Thanks for sticking with me till the end. If you found this video helpful, don't forget to give it a thumbs up, share it with someone who might need this information, and subscribe for more health insights. Stay safe and take care of your health.